My father was being chased for an undercover drug operation. He was running from the cops. Shortly after my dad was incarcerated, my mom had my brother, and that was the first time my dad saw my brother, was behind a wire fence at visitation. And I didn't know that that wasn't normal. The first time I got caught breaking the law, I was in the 4th grade. 8th grade year, going into 9th grade, everybody was like, hey, let's get drunk. And that was the first time I had drank. Those are the types of conditions that led up to this time in my life where I was just incarcerated for over a decade. There was something inside of me that I wasn't okay with, and I used these things outside of me, like people and liquor, drugs. I used these things to try to make me feel better, and it never seemed to do the trick. I always needed a little bit more. I didn't know that I had an addiction. I didn't know that in my genes was someone who was bound to be incarcerated and drug addicted. I became a very serious IV meth user. I was smoking a lot of crack. I was doing a lot of robberies. I was a very shady individual. I was not to be trusted. I think the first thing anybody who's getting out of prison can do to help themselves is plug into the parole office and submit, straight up, because they're gonna have connections for peer support services, jobs, food, nutrition, support groups, just collectively overall. It's becoming a hub for setting you free.
We are looking for this to be a one-stop shop. You're gonna come in, you're gonna do your initial J&S appointment, and what we're looking to see is that complete integration of you're starting in the probation office and you're gonna continue to be directed to those services, and those services are gonna start for you right here as well.
They get the medical appointment set up for them right away with referrals, with references, so they can get back on track physically in order to continue on parole.
They can talk to their peer support mentor and us about their housing needs, their health needs, and their behavioral health needs all in one stop.
Even the probation officers, we have a room that they can come and meet with their probation officer directly here.
So when they're here to see their probation officer, we're able to engage them, help them set up appointments.
It's great to be able to go in one place and get all the services that you need.
Makes it easy for the person receiving services, not so overwhelming.
We can save all those stressors, the barriers. We can help the member get exactly what they need when they need it.
Because they come in and they take care of everything at the same time, be it having to see case management, see the doctor, or see the psychiatrist.
We're all right there, so if we're seeing a problem or hearing a problem, we can bring them straight in, somebody who can deal with it right then versus waiting a couple weeks or emails back and forth and losing something in translation.
The goal is to help the person have a higher quality of life with medical and mental health while helping to reduce the recidivism to the criminal justice system.
We're getting the ability to get them enrolled in access, enrolled in services, review their terms and conditions of probation, and really get them set up with a head start over somebody who doesn't have that integrated service.
And we can just put you in the right direction so that you can be successful.
It's important for me to share my experience and my story in life because that's exactly what inspired me to believe that I could create a better outcome for myself, or that it was even possible. I heard a man in the world of recovery talk about how he suffered and about how he related with my pain. And when I heard that, it made me believe that I could achieve what he had, which was freedom. Freedom from addiction and freedom from incarceration.
I was in the suicide ward, and the whole time I just sat on the toilet crying. I didn't see my life going anywhere but in and out of jails. I didn't see how I was going to be able to make a change because I've tried to make a change on my own before, and it was impossible.
I'm a recovering addict, and I have 15 years in the Narcotics Anonymous program, and communicating with them and explaining to them where I was and how I got to where I was and where I'm at now gives them hope, gives them trust, and I think reassures them that I'm just here to help.
Hearing him talk and the things that he told me he'd been through gave me the ability to relate to somebody, and it made me feel that maybe I can do this.
I've been there, I've done that. I know how you're feeling. Let's work together as a collaborative team on how we're going to get that person integrated back in the community successfully.
We work with their transition. We teach them a lot of skills to transition from prisons or jails, re-entry, especially if they're repeat offenders, We show them that it's not a revolving door.
If I've been successful in re-entering back into society from the Department of Corrections, which I have been, then I feel like I can teach another person to follow that same path that I went on.
They're not going to be alone. They have somebody that can help them and be a sounding board for them and give them advice.
A peer support specialist can kind of join with that person and say, hey, I'm going to walk this path with you. I'm going to walk this journey with you side by side. And so when you hit a bump or hit a snag, I can maybe share my experience of how I navigated that challenge.
Just having that person, being there when they're about to relapse or they have a trigger or anything, having someone to really guide them through and for them to reach out to is really important.
One of the great things about the services that are offered by the TI clinics is that for the family of choice, for the person that's coming out of jail or prison, whoever they're going to be living with or staying with or that they're related to, they can get an opportunity to talk with someone and learn from someone who's been in that experience of welcoming home someone from jail or prison.
Your family member needs to ask for family support as part of the services that he's allowed to request. And once he has requested that family support, you'll be contacted by somebody who is credentialed in forensic family support, who has that lived experience. And then together, you and that family support partner will make a plan for what it is that you want this process to look like for you, as long as your loved one is receiving access and engaged in these TIP clinics. You'll continue to receive family support.
When my brother Trey was released from incarceration after serving 7 years, he started his time as a teenager and was released 7 years later. I wish that this had been available for me and my husband when he came to live with us. We would have understood that, some of the challenges that he had been through, we just needed to give him time and not necessarily be in his business all the time, but also, what the right things to say and do to help him.
We can be successful. Like, it's possible that we can come out. We don't have to be a part of the system forever.
I can recover in a more positive environment, and I can be a successful community member.
The support that's there from a peer support point of view, you can't find anywhere else.
I had a friend who came to my house who was coming out of the nightmare of drug addiction and incarceration, and he landed at our place and he didn't have anywhere to be or go. But at the time, I was sober and all my roommates were sober. We were living a great, we were adding to the community. We were good community partners. This guy said, "Can I stay at your house for 4 days?" In those 4 days, he saw what we were doing. Eventually, I come home from work one day and he's sitting there on the couch and he's just in tears and he says, "Hey man, I don't know what you guys are doing, but your life is amazing. I want what you have," right? So I said, "Sure man, stay here. You can live here now. Just do what we're doing. Go to meetings, do sponsorship, work the program," and he started doing that. So along the way, it was about 4 months in, he went to the doctor and he got a checkup, and there was just some small things that they wanted to look into, and they continued to do some blood work and different tests and stuff like that, and eventually found out that he had serious, like, stage 4 cancer. He wouldn't have known that he had cancer hadn't he asked for help from people that he saw were doing the right thing, you know, and took those suggestions, and eventually found himself in a healthy state of mind to look for a provider, you know. His cancer's been in remission for like a decade now, you know, and it's a beautiful story to know that, you know, I thought we were just helping this guy get sober, but in the long run, like, he got like cancer free because whenever he got sober, he started to care about his body, you know, and he went to the doctor and he was able to really look at what was going on, and because of that awareness, he didn't die of a disease that's killing, like, you know, hundreds of thousands of people.
If they're physically not well, how do we expect them to think properly? How do we expect them to get a job? How do we expect them to be successful?
When we collaborate and we're able to look at it from a whole health or a well-being, overall well-being standpoint, we see that it's not just behavioral health, it's not just medical care, it's not just compliance with community corrections. It's all of them put together.
They're told all these things, they're told all about how they can do this, but they really don't know the method of getting things done.
We're having that warm handoff to the TIP program, so the provider there, where now they can have more one-on-one conversation on what they can do to address some of the needs or the risk factors that we have kind of identified, and they take them to the next provider from there and have that warm handoff where they're taking them inside, they're helping them get set up with, you know, making their intakes and their appointments and helping them, you know, step by step follow through.
The great thing is that nobody gets lost in the shuffle because we're here to treat the whole person, and so we're going to figure out everything that we need to do to help the person reach their goals.
It is important for their success because all areas of their life are being looked at and supported so they can have success in the community.
When I look at these new clinics and the way that these satellite offices are embedded into the parole office, I think of like main control for reentry.
For those coming out not knowing where to start, not knowing what they need to do, having our probation staff educated on who to reach out to and kind of focus on what's most important and work on one thing at a time will help them succeed in the community. And that's where the Target Investment Program has come into play. That really closes the gap with communication and closing the gap for services. So we're not having to reach out to all these different providers, giving them a list of all these different names and numbers. It's just one place they need to go and everything can get handled here, which really helps improve the outcome for our clients.
I received a phone call as I was leaving yesterday, and the person thanked me and for coming in and helping them, and I said, "What made you come to us?" He goes, "I knew you'd help us."
They report to the office, we will address that then and try to find a solution on, hey, I need help with substance abuse, where can I go? I may need help finding employment, where do I go? The importance of having that information here in the office or other resources is vital to their success in just in society.
They're starting from ground zero. And so when you have the TIP program, DES in the same offices as we do, it helps them out. It's huge.
You haven't lost your humanity because you've ended up in jail, and you know, I validate them. I validate their pain, and I validate their experience, and I validate their humanity.
Well, my experience of being in prison, it was very hectic. But coming out here and getting the support and to adapt to everything, to society, you just got to take advantage of it and just succeed it and try to accomplish it and try to go through it.
For anything that he needs help with, they're there to help.
Yeah.
So this program it's done wonders.
They could have given up on me rather than giving me that second chance, and because of the second chance, I'm doing so well today. Like, I'm so grateful for it. Like, seriously, I want to cry.
So with the TIPS program, it has given me confidence. It has made me be a better me. There's so much support that they are giving me. And my dream is just to be a peer support specialist and give back to the community and help people like you, who were people like me, just to, succeed in life. And that's all it takes, is somebody there to give you a helping hand. And I wish you the best.
All of that's happening under one roof, like with a whole team of people who have defragmented the whole system. And ultimately what we want to be able to do is walk in there and have access to everything under one roof.
My experience has been really good. I did have access when I first got out of prison, and I was able to qualify, and I felt like my providers were really helpful. I felt that I was getting really great care. I felt that they were understanding of my situation. I didn't really feel judged by anybody. I had very good experience with that.
Part of getting my life back on track started out with getting to the doctors and Access, cover me when I got out. The person I talked to, like, oh, this is where your doctor's office is. We can, set you up an appointment if you need our help with that. And they helped me with it. And I call in and I need to change to a doctor closer to me, and they helped with that. So just the willingness that they had, it was something that was new to me that I needed help with, and they were there to help me. Having that coverage and having that support to get healthy again was definitely beneficial.